She was actually graduated from University Science Malaysia with medical degree and postgraduate in University Malaysia with a master in public health. She has been in the Ministry of Health for 25 years. Wow, 25 years. And currently, she's the head of elderly health sector, family health development division of Ministry of Health Malaysia. She involved in various technical committee regarding the elderly health policy development and research. Today, she's going to share with us supporting elderly health in the new era. So everyone, let us welcome Dr. Noraliza Binti Noordin Merican. Let's welcome.
Yes, thank you very much, Madam MC. I'm Dr. Noraliza. Assalamualaikum, and a very good evening to everyone. Today, I'm going to play my video presentation, which titled Supporting Elderly Health in the New Era. Let's see our video presentation.
Good evening, everyone. I'm Dr. Noraliza from Ministry of Health and currently in the elderly health sector in Family Health Development Division. Just for, an, just for an introduction of my sector, the main function of my sector is to plan, monitor the implementation, and evaluate elderly health programs and its activities according to the current available policy and its plan. We plan elderly health programs for our primary health care and communities covering the promotions, health education, health screening, referrals, and community participation. What I am conveying tonight is how are we going to support elderly health in the new era. In the era and the coming years, we may face challenges. Some of the challenges the older persons are facing and going to face is ageism as one of it. Ageism is discrimination based on age. As someone gets older, most of the public assume that every older person needs a helping hand, but older person may want to be independent and support is given when she or he requested or where time is needed. When we talk about the social care needs of the elderly, we are referring to their physical, emotional, and intellectual needs. In the National Health Mobility Survey for Elderly Health, which is conducted in 2018, shows that 30.8% of the elderly having poor social support. However, there is no significant difference in the prevalence of poor social support based on the places they live, their sex, or their occupation. However, poor social support is seen higher among the single elderly compared to the married ones. This study has also emphasized that the importance of social network among elderly, such as among family, friends, and the community. It is therefore important to increase the social support and networking among the elderly by providing avenues for them to actively participate and engage with the community. The economic impact that we've seen globally as population aging are declining in the work age population, increasing healthcare costs, unsustainable pension commitments, and changing demands drivers within the economy. This issue could significantly not only impact the advanced economic countries, but also developed nations such as ours. Whereas living arrangement for the elderly is more of a long-term care strategies. That is one of the challenges. Various studies conducted in Malaysia shown that elderly prefer to age in place during their senior age or during retirement. and the Ministry of Women, Family and Community Development is currently engaging in a research of long-term care model for Malaysia. And the challenges in the health is the health-related issues. We have geriatric symptoms, mental issues, non-communicable disease versus communicable disease. And currently, with the COVID-19 pandemic, the elderly is one of the focus population that need protection against the virus. And this season, I shall focus on the elderly health. Just for your information, WHO has come out its second plan on WHO Global Strategy on Aging and Health. And this new second action plan document is called Decade of Healthy Aging 2020-2030, which focus on older people to improve their life, their families, their communities in which they live by bringing together governments, civil societies, international agencies, professionals, academicians, the media, and the private sectors in a sustainable collaboration. So, why do we need concerted, sustained action? What should we do? Who are our partners? And how do we make it work? Firstly, why do we need concerted, sustainable action in supporting elderly health? In this slide, it shows that Malaysian population percentage from the year 1950 to the projection of year 2100. This is There's an obvious increase of aging population which starts in 2010 onwards and progressively increase throughout the years. Whereas the younger population, which is the 24 years and below, showed the decreasing trend. From that, we started to recognize that we are moving towards aging population. Some developed countries and we pro country members uses the margin of 65 years and above as the definition of older person, but as Malaysia, we define older person or elderly as an individual aged 60 years and above. From our Statistics Department data, Malaysia was an aging nation started in 2018, which is more than 10% of the population is above 60 years. And this country is expected to reach aged country status in the year 2030, which more than 15% of our population will be 60 years or more. So we have 10 years to go in facing the aged nation. As many countries facing similar situation, we actually have to be prepared. The second reason to why we have the actions is to value of having good life to years. There is no doubt good health adds life to years. This opportunity of good health arises from increased longevity depends strongly on healthy aging. A person that experiences extra years of life in good health will be able to participate in society engagement. If the extra years of life are dominated by poor health, there will be dependency care and much more negative implication to the older person and society. Another reason is needed to address the inequity to resources in achieving healthy aging. As we know that life expectancy in women is longer than men in Malaysia, and this has caused the feminization of aging population. A study in Malaysia, which is done in 2000, the year 2000, shows that majority of older women in Malaysia are economically vulnerable and frequently marginalized, from the mainstream of society. They suffered from incomes that are low while facing escalating medicals and other costs of living. Therefore, the inequality addressing the gender is important. After knowing why we need the supporting actions, now what should we do? Here there are four areas in which I will convey, and these areas are strongly interconnected. First, we have to change how we think, how we feel, and how we act towards age and aging. Despite various contributions of older people to society, there are still negative attitudes about older people. There are stereotyping, prejudice, discrimination that actually affects people at any age. But this can affect worse to a well-being of older person. When to start the change? Start now and internalize it in an early age. We should have a balanced view of aging when presented in the media or in the social platform or entertainment. We should increase the public knowledge and understanding healthy aging through many mediums. Secondly, ensure the communities foster the abilities of older people. Aged friendly environments are better places to grow, to live, to work, and to play at any age. By removing physical and social barriers, this will enable people at any age to continue the things that they value, even though they may lose capacity. Thirdly, deliver person-centered integrated care and primary health services responsive to older people. We know that the older people require access to good quality essential health services that include prevention, promotion, curative, rehabilitative, palliative, and of life care, which is safe, which is affordable, which is effective. With that, Ministry of Health has been providing these services, but there are no doubts that there are still gaps and that we can improve to increase the accessibility. Fourth, provide access to long-term care for older people who need it. The current approaches to providing long-term care rely heavily on informal care. Most of it are from family. But we have to acknowledge that the proportion of older people increases, many without families, and the proportion of younger people available to provide care decreases. As I mentioned in my previous slide, that Ministry of Women, Family and Community Development is currently engaging in a research of long-term care model for Malaysia. We hope that with the findings of the study, we are able to build a system to meet the needs of all the people for long-term care, which includes social care, support that help them with their daily living, their personal care, and enables them to maintain relationships to age in place. There is the right for them to access community services and for them to participate in activities that give their life meaning. Who should do all the actions? It needs commitment, it needs collaboration of multi-sectoral and multi-stakeholders. This is not a one-man show. There is a need to engage older people, family members, their caregivers, and the communities to jointly participate and advocate for the actions. Nevertheless, we need strong, effective governance and leaderships to establish appropriate law, policy, national frameworks, financial resources, and accountability mechanism in all sectors and at all administrative level to ensure that people experience health and well-being. As I may say, in Malaysia, we are in luck and in a correct direction. We have Majlis Penasihat dan Perunding Warga Emas Kebangsaan, the National Older Person Advisory and Consultative Council, which was established as a mechanism for the implementation of policy related to the older person. The Secretariat is the Older Person Division Welfare Department. It is a platform that engages various stakeholders, from NGOs to other ministries, supervising the implementation of National Senior Citizens Policy and Action Plan. It requires a whole of government and whole of society response. Governments are responsible at various administrative levels for putting in place policies, financial arrangements, accountability mechanism to actually create age-friendly environment and build health and care system that really improve the lives of older people, their families, their caregivers and communities. Our government in the coming 12 nation plan that has been proposed, and we hope that our country will prosper and will have good economic growth. With that, we shall have resources to all that being proposed will be a realistic event. But nevertheless, without civil society organization, the NGOs, businesses, and community leaders support, which also play key roles in ensuring local ownerships of the plan and the engagement of diverse stakeholders, the support to elderly will not be realistic. Thank you for listening.
Thank you for watching my video presentation. Let me conclude that we are going to face various challenges actually now and also in our near future. And to face it and to continue to sustain and improve elderly health, we actually need teamwork. We need to work together and not only rely on government. So I hope this platform we actually got a good network in this forum, and let's hear from other panels. Thank you very much.